On today's show, we're going to be talking about the Canada Disability Benefit. What is wrong? What is wrong with the Canada Disability Benefit? The math. It's the math, everyone. That's the problem. That is a situation that we're going to be talking about today. So stay tuned, and we're going to be talking about numbers today on the Canada Disability Benefit. Stay tuned with my guest coming up next. Can't wait. Hello, everyone, and thanks for tuning in to PWD Allies podcast. My name is Brent Frain. I'm the host. And as always, please like, share, and subscribe to the content and tune into your favorite podcast wherever you find it best suited for you. As there's always lots to pile in, and if you don't have time to watch us live, listen to the podcast version or you tune in live later on, and you'll get to watch a recap of today's show. Today's show is going to be all about the Canada Disability Benefit. What is wrong with the Canada Disability Benefit? The math. It's the math, everyone. And today's guest is Cate. Hello, Cate. Thanks for tuning in.
Hey, guys. Thanks for having me.
Oh, it's wonderful having
Do you want to say where you're calling in from?
Oh, I'm from Cape Breton Island. So
Yeah.
way
if
back.
you put your toes in the water and I put my toes in the water, they're not the same water at all.
Yeah,
Yeah.
that's kind of on my bucket list, honestly, is to be able to dip my toes in the Atlantic Ocean. I would love to do that, just to say that I've done that.
Yeah, the West
Very
Coast,
cool.
and then we've got the East Coast. We're talking the furthest east we can
Yeah.
go, and we're broadcasting here from
Spanning the
Victoria,
country
BC,
today.
We're literally coast to coast today.
coast to
I
coast to
love
coast.
it. I
Yeah,
love it. Yeah.
and it is connecting the dots. It's connecting the math, the dots that go along with the Canada Disability Benefit. So,
That's
Kate,
just
what
it.
is wrong with the Canada Disability Benefit?
And the answer is everything.
Everything, all of the
But
above.
we can't just throw everything at the wall. We have to really drill down into things because if we don't know what we're telling them is wrong,
Mhm.
we're not going to change anything. We're just going to be screaming, it's wrong, it's wrong. But the things that they tell us, we know they're wrong. We just don't always know the how and the why that they're wrong. So when I got a link to that pre-budget submission survey,
Mhm.
uh, I went through and I did it. And not one of those little radio buttons had an option for the Canada Disability Benefit, disability rights, or disability supports. And not all of the questions, if I'm recalling correctly, had an other space where you could write in your answer. But everywhere I could, I I filled up every character. I said the disability benefit, and this is why. And I
Mhm.
realized that all of those things, there was like seven distinct reasons why it was wrong, and they all fell into one of three categories.
Mhm.
So there was the regulatory, there was the adequacy, and there was the barriers. And I went through and I decided I was going to write my own pre-budget submission, just like any one of the orgs might do. But I said, I can this, I've got this. This is easy.
Mhm.
I ended up being like one of those conspiracy theory nuts with a
Yeah.
bulletin board and the red yard and the
Yeah, the picket
finally
fences,
I
all.
ended up.
Well, you sent me and Brent the numbers, and I mean,
Wow.
when you
Yeah.
see them laid out the way that you've done it, it actually is like scary to actually see them on a page
Yeah.
where they're all like kind of categorized, itemized, and you're like, wow.
Very, very
We
impressive
all
the way you
know.
laid them out, though,
The
too.
way you laid it out was
Oh,
very, very well done, actually, and we'll share it in a second.
yeah.
Oh, well, thank
Yeah,
you.
yeah,
I I worked really hard on it actually.
yeah.
And of
And
course
and
my
and,
phone said,
I'm going to share the mug that we have here. It's the PWD Allies mug.
Limited
where do you get
edition.
that from?
Limited edition.
It's a limited edition mug, and it's got the logos on
We
each
we
side.
had we had one of our super fans, Trisha, made
Yeah,
two mugs for us. One for me and
yeah.
one for
Oh,
Brent. Yeah.
Isn't that
you
neat?
you don't have them available
Not
for
right
sale
now.
maybe
It's at
Not
market?
some
yet.
point. At some
At
point
some
we'd
point
like
we
to.
will. And
Yeah.
if you, and basically anyone who sees the mug. If you like them, let us know your thoughts in the comment section or send us an email. And if we get enough people,
saying them, we want a mug,
then we'll take the next step from that point on, and who knows, maybe we can turn to
I love it.
into shirts and caps, and who knows.
You know,
I want to get shirts with your face on it, Brent. That's like, that would be the ultimate.
Yeah. Yeah, with the mug beside it.
Breaking with Brent with your face on it.
Yeah, that'd be great. That'd be great.
Yeah. So anyway, where did you want to go now, Cate? Do you want to go ahead and share the numbers, or just talk about the report first?
A little bit about what got me there. We've been hearing for so long that this is going to lift people with disabilities over the poverty line, out of poverty. We have exact quotes from Carla Qualtrough about this. This was the purpose and the wording of the act. It then got downgraded over time to the point where it was uplift people with disabilities. There's no regulatory definition for uplift. I would just like to point that out. But we were told that it would lift people with disabilities over the poverty line. Then we were told it would lift several hundred thousand. Then it was up to several hundred thousand. And then it was like 25,000 when it matures. And I said, how? I hate math. I'm not going to lie to you. I hate math. It is my kryptonite. But when I need to understand it, I will hyper focus and I will understand those numbers. And those numbers they're really bad.
They're really bad.
Really, really extreme.
Now, just the other day, and you can confirm this with me or not, but I believe now I didn't bookmark the source. I'm terrible sometimes. I don't bookmark sources, but roughly the numbers I saw the other day were that the federal government claims that so far around 100,000 people have claimed the CDB. They've claimed it and they're getting the money. It's around 100,000 so far. And I mean, we have to remember that, like, when did it it came live on July 1st. So since July 1st, there's only been 100,000 people that have got the money and qualified for it. And the federal government is saying that they expect somewhere around maybe 450,000 at maximum to qualify for it. But as it is right now, only 100,000 have actually got the money. And they're expecting it to be about 450,000 at maximum.
That's it, eh?
Yeah, that's it.
Actually brings me to my least favorite number, and I told you guys this yesterday or the day before. My least favorite number is 1 million. And that is the number of patient visits that the College of Family Practitioners of Canada estimates doctors lose every year across this country to filling out Canada disability tax credit applications for their patients to access other disability benefits. And the main reason why I dislike this, and it comes back to the submission for the pre-budget consultation, is the disability tax credit uses a medical model of disability. The Accessible Canada Act says that we use a social model of disability. So right off the bat, they have used the one thing that exists in this country that directly contradicts the definitions that define the Canada Disability Benefit Act and the Accessible Canada Act. So they are saying you have to be disabled in a different way than those two acts stipulate to qualify for the benefits under those two acts.
Wow.
And so we're losing 1 million patient visits every year for doctors to fill out these forms so that their disabled patients can maybe get these benefits.
And it costs money to fill out.
So much money.
Yeah.
No doctor. I called up a bunch of doctors in my area and I asked if any of them had gotten paid by the government to fill out the forms for the Canada Disability Benefit. Not one had.
Mm-hmm.
They all said that they had had a severe upswing in the number of disability tax credit applications to the point where they are backlogged by months.
Mm-hmm.
But not one of them had been given any information on how to access that, what was it, 270 something $1 million
Mhm.
to cover the cost of filling
Yeah,
out.
to cover the cost. Yeah.
Mm-hmm.
So none of the doctors that I spoke
Oh,
to.
you've lost your audio a little. Oh, okay. It's back now. You lost your audio for about
Oh,
2 seconds there,
oh,
but you're
well,
back.
probably not important seconds.
Yeah.
So that is my least favorite number. Numbers matter in this conversation. 1
Yeah.
million means that this isn't just a disability issue or a disabled people issue or a
Mm-hmm.
disabled rights issue. This is an issue for all Canadians, because when able Canadians cannot go to see their doctor in a timely manner because they're
Yeah.
backlogged under unnecessary and
Bureaucratic red tape.
shameful paperwork.
Yeah, and one of the things you do mention in the report, like, I mean, I read it and I've got all your points. I took the first part of your report and I actually pasted it, so I have my own notes to refer to during the podcast here. But one of the things that you mentioned in the report that's applicable in my case, and I'm sure to thousands, is that, I mean, I actually do have the DTC, so I am on provincial benefits here in BC. So that's my first check mark, right? So I have that check box. I do have a DTC, so that's that check box. But now the Canada Revenue says, oh well, your wife makes too much money, so now you're disqualified. And so and,
Which
and,
is a
and
barrier.
yeah, it's a
Yeah.
it's a barrier, right? Because they should have made the benefit tied to the individual that actually has the disability. Because I made the point before on a couple of podcasts ago, is that, I mean, my disability is not shared. My disability is tied to me and only me. So the idea that if I'm married, that somehow the disability is shared with my wife, and that so then I become disqualified from getting any money is just stupid. It's just really, really stupid.
Yeah, I mean, the
Yeah.
CCB should be tied to the individual, not the household.
So
And
I cleared two hurdles.
yeah,
I have the DTC, and I am on provincial disability, but I'm still said, no, you don't qualify. Your wife makes too much money. And
well,
so
you,
it's
well,
not me that makes too much money, it's her that makes too much money that disqualified me. Not me that makes too much money, it's her.
where my situation comes
Yeah.
down to the CDB, of course, not getting able to get the DTC because you need a family physician that's or a practitioner that's willing to go through all those hurdles like you mentioned, Cate, and they don't have the time. They've got a lot of patients to other patients to deal with. My family physician refused. I mean, at the time when I heard about this DTC way back, I mean, many years ago, because my bank was telling me, oh, you should get the RDSP. I go, what is that? Oh, well, you need a DTC in order to get that. So you need to go through Revenue Canada. And here's the form. And I went and I talked to the Revenue Canada at the time, and they had one of their local offices in Surrey actually at the time, Neil, way down in King George there. Remember they had that
Yeah,
one
yeah.
where you could walk in. Well, I went and talked to them at the time, and they're like, so I had my documentation from the provincial for disability, and I gave it to them. They're like, yeah, so you won't qualify for this? What? And they just looked at it there and that, yeah, you won't qualify because you don't meet our criteria based on this situation. But you can go to your family physician. So I went to my family physician anyway, and he said, what is this crap? Yeah, Brent, you're disabled in BC. You automatically will get anything going forward from federal government. Here we
Mhm.
are.
Yeah.
Yeah,
Surprise.
yeah.
Well,
Yeah.
I also have the DTC. I got mine in 2022,
Hmm.
and my doctor was so backlogged then it took over 4 months for her to get to filling out the forms.
Yeah.
Mhm.
in 2022. I can't even imagine what it is now. I recently heard that somebody had had it submitted, and their My CRA account showed that there was a projected decision for like the end of November,
Oh
and
my.
that was at the end of June.
Hmm.
Ooh.
And I mean, if we're asking the people who need this money the most to go through the most hurdles
Mhm.
Yeah.
with the worst the worst number of applications of any of the poverty reducing measures in this country, the most restrictive criteria, and then wait 6 months to find out if they've even been approved for the first application hurdle.
Mhm.
Mhm.
This is, they either thought this through carefully and they like the way this is, or they did not think this through carefully
Yeah,
at all.
it's broken on
There's nothing in
purpose. Broken on purpose, right?
Well, here's the other problem that I hear in BC and British Columbia. Our provincial government, our minister who's in charge of the disability in BC, was praising the Canada Disability Benefits because they were waiting on the federal government to come out with the Canada Disability Benefit, saying that all recipients are going to get the Canada Disability Benefit. They didn't want to raise the rates because they're waiting on the CDB as a top up to the provincial disability benefit. And
Meanwhile,
yeah, meanwhile, nobody's qualifying
Yeah,
or
yeah,
very small amount of the population is qualifying for that up to $200.
yeah.
Some
But
people may not even
but
get
even when you look at the numbers, even when you look at the numbers, and again we will in a second, but
yeah.
you realize how inadequate the whole thing. Like even if you're including,
Mhm.
even if you're lucky enough to get the benefit, you're still so far below
Oh,
what is necessary, right?
way
Yeah,
fine, yeah.
yeah, yeah,
and every time I added a new row to that table, I just,
yeah, yeah.
oh, it doesn't get any better. Uh,
No.
what they they haven't applied any real world sense to this. They keep
Mhm.
saying we're going to lift you over the poverty line, lift you out of poverty, and then 25,000 whole people, which, quite frankly, out of 1.8 million Canadians who
Hmm.
live with disabilities and live in poverty, is 25,000. Hey, thanks. That's
Yeah, that's a
Like
lot.
such a token.
That's a lot.
that's like trying to fill this mug up here. Hang on, everyone's going to get a little bit. How many people are going to get a drink? You know?
Well, I mean,
Yeah.
and we've talked, and this is a different thing altogether. Again, I mean, we're going to have MJ on the show on Friday, and she's going
Mhm.
to talk about the shelter rate. And I know it's a different thing altogether,
Yeah.
but I
Yeah.
wanted to talk about we talk about numbers,
Mhm.
and here in BC, they say, well, we're providing subsidized housing for 25% of the people on disability.
Whoa,
25%.
wow.
Can you imagine if McDonald's said, well, we're just going to give hamburgers to 25% of our customers,
Or
or
the minimum wage to 25% of our
yeah,
employees.
and
Yeah.
then
Right.
we'll just kind of say, to heck with all the rest of you. I
Yeah.
mean, you
But the
can't do
question,
that, and yet the government thinks it's fine.
I kept coming back to the question, which poverty line are you talking about?
Yeah.
Because they really mixed up the their data in the regulations. They definitely use data from the 2017 Canadian Survey on Disability.
Yes.
They use the number of Canadians who have disabilities or who are uh, in poverty, but then they'll use some figures from the 2022. And I said, okay, you know what? I need to take a really good look at this
Mhm.
because I want to know specifically which poverty line you're referencing. It definitely isn't the LICO because the LICO is higher than the market basket measure.
Yeah.
And
Mhm.
that is more of a federal measure. And it's used mainly for immigration type
Yeah.
situations. So I took a look at the market basket measures in Canada. And I didn't know there were so many, to be honest with you. I learned a whole lot doing this. But when I was writing out this pre budget consultation submission, I said, okay, this is what we need to change. We need to make it tied to the individual, not to the family.
Mhm.
Because people who are getting child tax benefit, or what do you call it now, CCB, Canada's
Mhm.
Child Benefit, they're
Yeah.
having their CDB reduced because they have a child and they're
Oh,
getting Canada Child Benefit.
Mhm.
wow, that's
Uh,
bad.
I've so I said, okay, the individual. Now, for an individual, what is the poverty line in this country? And obviously, doing it regionally made the most sense because you can't say paying out based on the lowest
Mhm.
uh, market basket measure would make any sense to someone living in Toronto, Vancouver, or Calgary, where they're pretty much neck and neck for the absolute worst
Mhm.
when it comes to market basket measure and disability benefits. So I said regionally, and the highest market basket measure in every province because there's less of a fluctuation between a rural area and the
True.
biggest metro
Yeah.
area
Yeah.
provincially
Yeah.
than there is nationwide. So I took a look at it and I said, okay, how do we figure out what it is for an individual? Okay, they have a formula, divide by two. I got the number. This is a single person that we say it should be based on and what the market basket measure is for them.
Mhm.
Then I looked at Maytree's report on
Oh, yeah.
Compare 2024
Yeah.
because they compile everything and they do it so well with such lovely charts and they make it so easy to read and it aggregates everything, including GST or advanced worker benefit, all the maximum things you might get in any
Mhm.
particular province. And it worked out great with my regionalization
Hmm.
uh, thesis. So I took their numbers and from 2024, because we also have a market basket measure for 2024.
Oh,
So we have a complete set of data.
Oh,
Let's
so
take a
I
look.
didn't even know that they released the market basket for 2024. So that's a
interesting.
fairly recent thing, I think, because
It
I
is
think
fairly recently. It was,
yeah.
I want to say sometime in the summer that it came out.
Hmm.
So, I mean, before that, we were all working on 2023 numbers and knowing
Hmm.
that there would be a year and a half of
Yeah.
additional inflation to deal with.
Hmm.
But now they have the 2024 numbers out. So I said, okay, great. We have a complete data set. What does this tell us for the individual that we say should be applying and
Hmm.
have their eligibility based on their income?
Hmm.
I just saw sugar peas come into the house. That's really exciting. Um, so, so I put all of this in a spreadsheet and, Excel, some bracket, blah, 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 tell me the magic number.
Yeah.
And they kept coming up red. Nothing was not right.
Yeah. Well, you want to do the screen share now? You want to turn to the spreadsheet now?
Sure.
Okay. So I'm gonna click my magic button and we're gonna go to a screen share.
Show me
And
the numbers.
and there we go. And it's a little bit blocked on the, I might actually get rid of our screen share window just because it's in the way. So I'm gonna minimize it a little. Oops.
Sure.
I'm moving things around too much. Sorry about that, people.
No
Just trying
worries.
I'm just trying to minimize our window here.
You could put it right in front of me
I'm gonna
Yeah,
get
there
it
you
out
go.
of the way so people can see. And so here we have the spreadsheet, and I hope everybody can see that well. But like I really liked the way that you laid everything out because you did it by province.
Hmm.
You even put the Alberta. There's the two sets of standards for Alberta, right? There's the kind of the welfare number, and then there's the H number, and you've included both of those.
Manitoba also has two separate programs. They
Manitoba as
also,
well. Okay. But
and
yeah,
Nova Scotia is an
it's very
asterisk
well laid out. Yeah.
because Nova Scotia is still trying to crawl out of the class action lawsuit about the
Hmm.
disability support program. They
Oh,
are woefully behind on actually fulfilling the remedy. But in Nova Scotia, you only get disability support if you live in a care home, a group home, a halfway house, or some type of institution.
Oh,
You do not get disability support if you live independently. So, what they do have as a way of working into that remedy from the class action lawsuit is enhanced income support, or yeah, that's what it is. The enhanced is an extra $300 because you are disabled. They say that it's going to be fixed. I don't know when, but because of that, Nova Scotia also has two programs. So in 10 provinces, 13 different disability programs.
mhm.
And I really, do you know how hard it is to find these numbers sometimes?
They probably say there's more to do. There's probably more to do to fix it.
There's
Kick the can.
provinces that are so not transparent about what benefits for people with disabilities are.
Mhm.
They say you could have up to, and I mean, we've heard that
Yeah.
phrase how often. They don't tell you how you qualify or what you have to do to qualify or what your final number might be. They tell you you have to apply and someone will tell you. But I, through digging through the internet, I found 13 programs in 10 provinces. And
Wow.
then I had the numbers to compare.
Uh,
So in BC, where you guys are,
Yep.
The market basket measure for a single person is $29,754 in 2024.
Yeah.
But
Well,
full benefits are 22,245 if you get all of the GST and all of the extra provincials and all of the Canada Disability Benefit.
Hmm.
So people in BC are immediately, oh,
Yeah, like if you only get the provincial benefits,
yeah,
you're only at $19,000 for the whole
yes.
year.
Well,
Yeah.
yeah, and then adding the 2,400 for the Canada Disability Benefit brought it
Hmm.
up.
Yeah.
But that is still so far below,
Hmm.
that's $7,509 below the market basket measure to begin with. And we haven't even
Hmm.
added on 2025's um, inflation. We have not added on the 30% that we all recognize the
Yeah,
United Nations said it
the
in
crip tax we call it,
2018.
right? The crip
Yeah,
tax.
tax, yes.
Yeah.
uh, it's it's the premium. It's how much extra it costs to live with disabilities.
Yeah. So
Yeah.
basically,
Because,
$7,500. Basically, that's loss in that. Yeah.
well, yeah, exactly. For British Columbia, that brings the market basket measure for a single person $38,680, and I apparently need a new pair of glasses because I could not see that number. Thank goodness I'm getting that $200 a month. Now I can buy glasses. But I mean that is what it comes up to. The market basket measure for one person in British Columbia is just shy of $40,000 if you have a disability.
Wow.
But disability supports combined are a little more than, well, let's say 60% of that. 60% of what you need to only be poor.
Hmm.
And
Mhm.
they don't look at it that way. They say, it's a good start. You have to remember that it's a first step. Meanwhile, we were told the whole time they were focused on getting it right,
Yeah.
but now it's a first step. So that leaves people in an untenable position where they have to choose between having a roof over their head or being able to eat or being
Mhm.
able to heat their home in the winter, which I mean, here in Nova Scotia, it's hard.
See, the base amount in BC for PWD for persons with disabilities, the base amount, that's without any extra subsidies that they may qualify for, like dietary supplements or
Yeah.
whatever supplements. It's 1483.50. See, times that by 12, and then we get a total of just over $17,000.
Mhm.
Yep. And so that's way, way below
And then
the
if you get
beyond.
2,400 extra dollars, woohoo, you've just passed $20,000
Yeah,
Exactly.
and
in a province where you need almost 39,000
They would say
to
BC.
market basket measure.
and in on the table, Kate, you have a part on the table where you talk about 2021 numbers and also pre
Oh,
2015. Uh,
but that,
s-
I
can
took a
we?
look at the market basket measure table from
Mhm.
Statistics Canada, and I took just the market basket measure, no disability premium attached to it, just the single person market basket measure in every province.
Mhm.
And I looked at how much the maximum amount of disability benefits a person could get in every province.
Okay.
Mhm.
Here, did that amount of disability supports line up with the market basket measure? So where it says pre 2015,
Mhm.
that number has never met because they only have going back to 2015 on
Yeah.
Statistics Canada. For places where I say it met in 2021, it means that in 2021, the combined amount of disability benefits and the market basket measure were close. They don't have to have talked. I just, if they were
Yeah.
close.
Yeah.
Uh, I mean, to say in so many jurisdictions that disability supports and the market basket measure never actually correlated by saying pre 2015. We don't know when
Mhm.
it might have been that.
Yeah.
That's that's embarrassing to this country.
It
It
is.
Mhm.
should be completely shameful to us. And I don't understand why it's not.
Mhm.
Well, and the other thing, I mean, I say this a lot, and I end up dating myself and making myself look really old. And I know Brent, you're getting up there too, the same same as me. But like, I'm old enough to remember Terry Fox. Like I never met him in person, of course, but like when he passed away, I was 12, I think I was. Like
Mhm.
we're talking 1980, 1981. I was about 12 years old. And then when you get to Rick Hansen and 1987, his round the world tour, which was great. And I never want to disparage anything that Rick Hansen did, but I just wanted to throw out those two examples and say like you have Terry Fox, you have Rick Hansen. I mean, those were two kind of watershed moments that should have kind of raised the bar and really kind of set the tone for our disability rights, really, right? And I mean, I don't want to say that Rick Hansen has done nothing or whatever, but I just want to say like overall I would say that ever since 1986, 87, uh you know there was some uplift for a while, but ever since then it's kind of gone backwards. We
Mhm.
we haven't actually improved things. We've gone backwards.
But remember, the Canada
I
benefit was supposed to be historic. It was supposed to be a movement to
you
change
know
things.
and like I've always said, it
For the
kind
better.
of started um with Mike Harcourt, especially in 93, 94, when he kind of set the bar on like how evil, how terrible can we be towards people on welfare, and by calling them cheats, varmints, and deadbeats. How low of a bar can we set?
Well, that was Mike Harris at the same time as Mike Harcourt.
Yeah.
Both did at the same time, and now we know the repercussions, why the systems are the way that they are, because it was orchestrated of copy paste going
Yeah, and so that's my point, is that we had these two individuals. We had Terry Fox and you know we had Rick Hansen, and that should have been, like I said, a turning point where
yes.
you have this uplift and an improvement.
Mhm.
And it's been like a backwards it's been like a backwards thing, kind of, and an
Unfortunately.
erosion of our disability rights kind of ever
I think
since.
The
Yeah.
problem was what they saw
I'm gonna go
was
back to a full screen
people
so
with
it's
substantial
Yeah.
disabilities doing incredible things.
Mhm.
So why can't all people with substantial disabilities climb a mountain, run across the country,
Yeah.
start a foundation? Honestly, uh, if I get out of bed some days, it's a
yeah.
major victory.
Yeah.
And it's not just because I think having a bed and watching TV day is awesome and oh so restful. It's because I physically cannot get out of bed,
Mhm.
Hmm.
which means I cannot run across our country. I can't climb a mountain. I can't swim across any. Well, I can't swim to begin with, uh, but by and large, people with disabilities are expected to do the exceptional. And
Hmm.
when we don't, we're just not trying hard enough.
Yeah.
Or
Mhm.
we're looking for handouts, or we're taking the easy way out because what they saw was that exceptional person that all
Yeah.
of us said, wow, thank you for
Yeah.
bringing disability rights to the forefront. And we didn't at the time. Well, I mean, I was 8, I think, when
Yeah.
Terry Fox passed away,
Mhm.
maybe 9. Um, I didn't realize through all of that that what we were seeing was the beginning of the toxic positivity culture toward
Hmm.
people with
Yeah.
disabilities.
Yeah.
Yeah.
You can do
Yeah.
it, and if you can't,
Well,
I
don't
remember
give
I
up.
think,
when I was when around the age that Terry Fox was doing his tour across the country. I was delivering newspapers at the time. I had just started a paper route, and they wouldn't let me. They made an exception, but you had to be a certain age in order to deliver papers. But I was helping out a friend doing delivering his route and seeing on the front page of the paper, Terry Fox, and I started really tuning in, watching the broadcasting on TV. I thought, wow, this is a person who really has the motivation to really make the country shine. I thought, like, people are really going to be focusing on that. I mean, that was
and
then,
he really did unify the
and he did.
country. I remember the speeches that he gave, and he
Hmm.
really was a good speaker.
Yeah.
You know, and you know, you can say it was kind of the beginning of I don't know what to call it, disability porn or whatever. But I honestly think that his heart was in the right place
Like,
more than what we have now.
yeah.
Um, like for example,
Inspiration porn is the thing that just drives
yeah,
me.
me
Yeah.
too. But what I was gonna give an example, Cate, and like you probably don't know, but here in BC, we had at one point, not too long ago, we had a minister that was responsible for social development and innovation here in BC,
Mm.
and she was a person with a disability. She was a Paralympian,
Oh, yes.
Michelle Stillwell, like
Right.
a wheelchair racer,
Mhm.
and her attitude was like, be like me, you know, I know life is tough, you know, like you have to make hard choices, like, you know, if you have $375 for rent, that's, you have to make difficult choices, but you know, be like me. And she would flash her medals, like her Olympic medals of
Oh, yeah.
silver, and
He
like
was
just
the
be
minister
like
that took away
me.
the bus passes, though, right?
And she was the one that took away the bus passes as
Right.
well.
Yeah. This.
You
Yeah.
know,
Disability
like
bus
she
passes. Yeah.
took away the disability bus pass,
Yeah.
like a person with a disability.
Yeah.
And it's just like, you know, and we had like the premier at the time. I'm convinced that Premier Christy Clark kind of used Stilla as a pawn,
Hmm.
almost as a joke to say, you know, I'm going to get a person with a disability to purposely victimize other people with disabilities because it'll be funny to have somebody with a disability to victimize other people with disabilities. It'll be hilarious.
I can
That's probably what Christy Clark thought. Is like, won't that be funny? Won't that be funny to have somebody with a disability purposely victimize other people with disabilities? That would be hilarious.
You know.
I
That was
can
probably her
remember.
thought.
Yeah, Cate, on what Neil was mentioning is about a bus pass. So what the minister did was she talked to a small group in a very rural area of British Columbia. I mean, way up in our Kootenay area, where it's a very isolated area. You may have a dial-a-ride or like a handy dart maybe, or not even handy dart very much, but I mean, they might have some. I know some areas do, but they don't have traditional conventional transit buses in those areas. So people would get a special transportation subsidy, they called it. And so they would get a lump sum from the government. They would cut them a check and say, okay, you can either buy insurance, you can go and pay a family friend. I mean, use the money for whatever you want. But everybody else in the urban areas would have transit pass. They could go and use, well, they couldn't use Handy Dart because you still got to pay separately for that. So I want to make that very clear to people that Handy Dart is always you'd still have to pay regular concession fare. You couldn't use your transit pass on that. I mean, you could, but you'd still have to pay a concession fare. But on the traditional buses, you would travel for free because you'd pay administration fee of $45 and you could travel anywhere in British Columbia that they had regional transit service. But in the urban areas, you would only get a lump sum. You wouldn't have a transit pass. So the minister at the time went to a small group, 6 people, maximum 6 people.
It was literally 6 people.
The whole system,
literally 6 people.
Yeah, changed the whole system and basically made it so that people could then either have $52 or have a bus pass. So what she did was those same group of people that were in the urban area, rural area, they took away the subsidy. So they took away their transportation subsidy, a special transportation subsidy. It was like $692 a year. She took it away and said, here's $52 for every single PWD in British Columbia equally, she said. So she said it was equal across our system. It was fair.
Equal discrimination. Equal discrimination.
But the people in the urban area could opt in or could opt out of a bus pass. So either have a bus pass or like take $52 and have it as cash. They could have it automatically as default. It would be added onto your check. If you don't want that money, have a bus pass. So you can see where that temptation is, that when the governments don't increase the PWD rates, people get desperation mode. They go and say, well, I need the money. So it goes out transportation, have 52.
It's like, do you want to eat this month, or do you want to be able to ride a bus? Do you want to eat this month, or do you want to ride a bus?
The government ran with it in their different platform of over time saying, well, we raised the rates. They used that $52 as raising the rates.
And again, somebody with a disability, made the decision to change everything and to punish 99.9% of the people that were on disability. She punished 99.9%. I mean, this system was working, and she broke it on purpose. And laughed about the whole thing, and Christy Clark, I'm sure, was laughing about the whole thing. This is funny. This is funny to victimize people with disabilities. It's funny.
Yeah.
Equality does not necessarily equal equity.
Exactly.
Yeah. That is the point of when I went through and I used regional market basket measures, because an extra $200 for someone in the lowest market basket measure area is going to hit different than $200 to someone living in Vancouver or Toronto. It's going to have a very different amount of buying power. So regionalization was the only way that I could think of to make it make sense. And I did this so that I could send it along when I did do that pre-budget submission, because I really wanted FINA to see what the reality was in black and white, hard, cold facts. Numbers don't lie. Sometimes the government lies when they really want to amp up their social justice cred, but numbers never do. And there is not one jurisdiction that crosses the poverty line with the market basket measure with what you get at maximum, including the Canada Disability Benefit. And there's definitely not one that comes anywhere close to the market basket measure, plus the amount it costs to live with a disability.
Oh, absolutely.
So just for fun, the column down at the bottom,
we'll go back to the screen share 1 second.
Yeah, I find it very interesting about the buying power. I'm sure people listening to the podcast today, or watching it live right now, and they can relate to the buying power of what you used to be able to buy, say with $20 or 100 or 200 or, whatever it may be. And now the basket goods of services that you can get for that same value, you cannot get what you used to be able to get.
Nothing even close.
No.
Just for fun, down at the bottom, I broke down the yearly stuff by month, because we all think by month. That's the kind of check we get. I get Canada Pension Plan Disability. I don't qualify for enhanced income support in Nova Scotia. So also monthly. We all think in terms of our monthly check. Last row at the bottom, I thought, let's ask the CMHC how much a one-bedroom apartment costs on average in every province. And
be interesting.
So in Alberta,
I get ready here.
$60. So they keep saying, but we pay the most. We're taking away the Canada Disability Benefit from AISH recipients because we pay the most.
Oh yeah, we got to claw it off them. Yeah.
Yeah, and they're also the whole ADAP thing, and I still have not fully metabolized that yet.
I know, that doesn't even make any sense to me. I saw that and I was just ready to vomit, really, as soon as I heard about that.
But I mean, they keep talking about AISH being the highest. I would like to talk for a moment about the other program in Alberta being the lowest one.
Barriers that's embarrassing, that one.
Expects you to live on a combined $1,260 a month, including the $200 for the Canada Disability Benefit, assuming they have a quota back.
Yeah.
And
which they already said they will. They already said they will.
I haven't seen them say it specifically for the barriers to full employment, only for the AISH.
Okay.
I have a nephew in Alberta who's on AISH, and I've been helping my sister with the advocacy there. And I've looked, I have not seen them specifically mention the BFE. It would not shock me if they are, though.
Yeah. Hopefully they don't.
I would love to hear from anybody who can tell me yay or nay on BFE. Because that is a demographic I don't have any inroads with.
Yeah.
But yeah, $1,360 for an apartment, but you get $1,260 a month total.
Yeah.
The math doesn't compute. The math doesn't compute. Yeah.
No. So how are you supposed to not live on the street? Exactly. They complain and they groan about how many more dangerous people are on the streets. Why are you putting people on the streets? People with disabilities have 4 times the likelihood of becoming unhoused compared to our able counterparts. And that is 100% reflected in these numbers, how we end up unhoused. It's how we end up dying of malnutrition. It's how we end up thinking, maybe I should look at medical assistance and dying. These numbers aren't just numbers. These are people. And that is the part our government has completely forgotten or refused to accept. Because that shaded line down at the bottom on that first sheet, that shaded line shows the amount that the Canada Disability Benefit would have to be in every province to bring people with disabilities to the poverty line with the disability premium.
And it's red right across the board there.
Yeah. And how about in Alberta with barriers to full employment? It would have to be $1,962.
Oh, yeah. And I mean, and with in the price of accommodation, that would just barely pay that. Like, I'll give you an example, Cate. In British Columbia, where in a building that I live in, the rent for a 1-bedroom, I found out, is now $1,900. $1,900.
For 1 bedroom.
Get $1,483.50. Okay, so there's another building that's just a couple roads down from where I live, and it's going for $1,825. There's another building beside it by the same company. They actually are going for $1,875. That's just within the realm of the companies that I rent from. Now, there's other management companies. They want $2,200, $2,300 for a 1-bedroom, over $3,100, $2,900 for a 2-bedroom. Like these prices are ridiculous. Now, these prices, folks, that I'm telling you, those are the prices that when they're occupied.
Yeah.
Okay. So when they're not occupied, now the market will bear what they want to go up to. So if they can't rent them, they're going to come down. Now I heard through the grapevine that the management company I rent from, they're having trouble trying to rent some of the units. So why? Because they're charging too much money. So even if they drop it down to $100, I mean, it's still way above what a PWD or a senior or anybody on a low income, fixed income can afford.
And how far below every single jurisdiction came from the market basket measure. And the market basket measure doesn't really differentiate. It takes shelter into consideration, but it doesn't show how shelter has skyrocketed.
Yeah.
Or here's my thing. I bought coffee the other day. Yeah.
Oh,
Went
yeah.
into Walmart, great value brand, dark roast coffee.
Yeah.
And it was $15.
It's
And
expensive now. Yeah.
Oh,
I
wow.
found a receipt in my purse from February where it was $7.97.
Wow.
Yeah, wow.
You got a gold deal there.
It doubled since February. So the numbers that we have for the market basket measure right now that we can access, they don't reflect the current reality. I mean, they keep saying inflation's going down. That means prices are still going up, but not by as much.
Yeah.
So the way it's phrased, it always makes it sound like, hooray, prices are going down. They're not. They're just going up by less.
Smaller amount are going up. I mean, food inflation is going up. I had picked up, was it last month? There was a great value, I think it's called Excellence Coffee from Walmart. They wanted $18.97 for it. Now, Superstore, they have theirs for $22.97. At Shoppers Drug Mart sometimes has it on. Sometimes they'll put it on sale for $18.97. And when you see it for $18.97, you're like, wow, that's a killer deal. That's the gold, right?
Well, even shrinkflation, Brent. I mean, remember how like muffins used to be in like a pack of 6 muffins.
Yep.
Well, now you regularly see muffins packed as a pack of 4 now, and they charge the same or more for 4 muffins versus 6. Or like smaller packages, like I mean, we had the example of what was it? Where we have McDonald's or it was Tim Hortons, and they're small now. Their small coffee was like this.
Yeah,
it was like a shot glass of coffee.
I was in Dollarama just recently. I was looking for a squeegee for a window, and of course they don't even have this long stick. It's like, oh come on! It's like anyway. So I'm looking around, and I look on the shelf, and for the checkout, I'm going through, and they had the Smarties. You know how big the box was. Now it's like a tiny little box. It's like. And the price had gone up, and the device and the item is just so tiny. They call it Wonder Bars, whatever. They used to be bigger, a little bit bigger. Now they're tiny.
They should change the name to Wimpy Bar now. Wimpy Bar.
Wimpy Bar. But all these items, they're finding the manufacturers are finding ways of making them a lot smaller. Prices going up. I mean, rent's up, everything's up, but our incomes have not matched the actual value.
No, and we're being told that we need to be more judicious with our income. Maybe don't spend so frivolously. And my question is, when you look at these numbers, how can you say that with a straight face? How can you know that you're bringing in less than the deep income poverty line and tell people they're not being careful enough with their money?
Yeah.
You're starting at 50% of the poverty line in some cases. I mean, kudos to Newfoundland for starting their own disability.
Well, we're actually trying to get Chad Harridge on. He's from Newfoundland, and he's actually saying that has turned out to be a bit of a joke too. But so I'm hoping to get him on soon, and he's going to talk about how that's kind of failed as well.
One other thing that I want to mention is that I finally went to my MP. I sent an email. I said, I would like to book some time to sit down with my member of parliament, and I would like to speak about the Canada Disability Benefit. And I I came with handouts. When I talk about this, I always have hard copies to hand as I'm saying my spiel. And I went there and I said, listen, this is a very unique riding.
Mhm.
This area, Nova Scotia has the highest percentage of people with disabilities per capita.
Oh, wow.
Uh, we lead the country at 37.9% people with disabilities.
Oh,
Uh, the area I live in actually has the highest rate of cancers and other disabling illnesses in the province that has the highest rate of disabilities. So the two MPs on this island have a uniquely poor, a
mhm.
uniquely old, a uniquely disabled, and a uniquely sick constituency. So I went to him and I said, this is a you issue. Like this has got you written all over it. We are asking you to help us advocate for Canada disability benefit reform in the House of Commons. And I laid it all out. Like this is this is how many people in your constituency
Yeah,
statistically have disabilities. And
Mhm.
this is how much they are getting from the province of Nova Scotia if they are not institutionalized
right,
for
right.
disability benefits. And here is what the market basket measure is. And here's what it's doing to people. And I had the MAID statistics and
Show them
I
the
said,
facts, yeah.
Mhm.
I said, we're asking you, I am asking you to please help us. And
Yeah.
he did indicate that he was very willing to. He was one of the MPs that signed Ryan Turnbull's letter
Mhm.
right before the 2024 budget. So I knew it wasn't completely something he needed to be schooled on, but I guess that he probably needed a few
Kind of give them
blanks.
a good push, yeah.
He didn't realize that it was as dire as it was when I
Yeah.
laid it all out. But I'm telling everyone I come across, get an appointment with your MP, get an appointment
Mhm.
with your MLA, the address the numbers
Hmm.
Yeah.
as numbers. Like I this is not even me using hyperbole. This
No,
is me
these are the
using
actual numbers, and the numbers don't lie. Yeah.
Exactly.
and when they're presented with it that way, it is far more
Mhm.
difficult for them to say, you're just not being creative enough with how much
Yeah.
money you're
Yeah,
being
Yeah.
given. The whole given thing really bothers me too. It's like,
Mhm.
it's
yeah.
not a
Well,
present, guys.
well,
The part that really bothers me, now if there's forever opportunity right away, I'll
okay.
just quickly slip this in here, is you go to a ministry's office and, the part that really pisses me off is live within your means, budget better. I mean, are you kidding me? Like, how come you can't make your check stretch as far? I mean, wow, I'm sorry, buying power, that's what happens.
Well,
Don't raise the rates. I mean,
that's why those numbers are why,
yeah.
because
Mhm.
that's how much it costs to rent housing. We all know how much it costs to buy food. We all know how much it costs to heat our homes. And I mean, I live in an old house in Nova Scotia and winter is coming up and we use heating oil.
Oh,
Oh,
yeah.
okay.
Oh, yes.
So I mean,
Mm.
uh, we're probably going to get, I think last year we got a $600 rebate from the provincial government to buy
Oh,
oil.
Right.
That was 1 month.
okay.
One
Oh,
month.
1 month. Oh,
Wow.
In an old drafty house.
Mhm.
That's I look at my front door and the North Atlantic is literally right there. So I get the wind.
mm.
$600 got
Mhm.
me through 1 month.
Oh,
Wow.
And how are we supposed to stretch our money better? But
yeah.
if you look at that second sheet on that Excel document, I actually brought this problem to the federal government too, because I took a look at what they say the average Canada Pension Plan disability check is,
Hmm.
and that is fourteen
I'll drop.
thousand $386.88 a month or
Yeah.
a year. And
Just,
they are also subjecting people to below poverty line
Yeah.
wow.
Yeah.
subsistence existences. And
Yeah.
then they say, well, nobody goes to MAID because they're poor. Well, what
Well,
happens if somebody is alone and
yeah.
somebody is uh, dealing with having no food or no electricity or
Mhm.
no no roof over their head.
Yeah.
Mhm.
How long does it take before you go to that thought? Especially
Exactly.
when doctors are now
Yeah.
saying, do you know about medical assistance in dying?
Hmm.
Mhm. What?
So these numbers have really, they actually upset me.
Yeah.
Hmm.
These numbers made me realize that it's so much worse than we already knew, because no matter how much they lied about how many people were going to be uplifted, we all knew that it wasn't going to be the thing that we were promised
Mhm.
since 2019. We all knew that it was absolutely, they failed. I don't know if they planned to fail or if they failed to plan, but they failed.
Yeah.
And
Hmm.
they failed real people
Spectacularly.
Oh
who
yeah.
have real problems
Yeah.
and really, really, really can't afford to not eat.
Mhm.
You can't get healthy if you don't have food.
No, 100%.
You can't get healthy if you don't have a roof over your head. You
Yeah.
can't get healthy if you can't afford your over the counter medications or go to see your doctor. So these numbers are a problem and they own them all. The
Hmm.
problem is not us. The problem is the numbers, and they are the only people who can fix them.
Well, you know what, Cate? That was actually your mic drop moment right there. So we are at the end of the hour. So I think that's a great spot to
I'm a
end off.
soundbite
Yeah. Perfect.
machine.
Yeah, like it was
Awesome.
really a perfect place to end off. The only thing I wanted to say as my closing comment was, on our last podcast we had on Friday, we had a podcast called Policies of Neglect, and how, again, how our provincial policies are broken on purpose. And we talked about MAID on that show, on the Friday show, on the last one. We talked about MAID a little bit, but one of the things I didn't mention, and I wish I did, was how MAID is kind of becoming part of the word cloud associated with disability. Like, how we talk about the word cloud of disability, like we have those synonym words of like
Mm.
wrecked, or broken or inadequate, all these other negative terms
Hmm.
associated with disability, right? Well, MAID is becoming, medical assistance in dying is becoming one of those word cloud things that is associated directly with disability, and that sucks. That's terrible.
It is.
That's terrible. And it seems like our governments, both federally and provincially, they don't care. They don't care, and they should care, because that's disgusting. That's disgusting that governments do not value, as we said on the last podcast, governments do not value, by their policies, they do not value life, they do not value death. They
You
do
know,
not value,
they love
yeah.
unicorns. That's
They
why.
love pink unicorns, but they don't respect life, they don't respect death, and they
You
should
can
do
actually
both.
search up a document from the PBO costing how much medical assistance in dying track two will save the healthcare
Yeah.
systems in Canada.
Yeah, and
But
it's
it's disgusting. It
number
really
is
is.
just way off. Yeah, it's.
Yeah.
I always say give people aid before made.
Yeah.
Give people the resources, give them the tools that they need to better their quality of life, their circumstances, and whatever that may be. And I mean, the governments for all levels, and it doesn't matter if it's provincial or federal or territorial, you've all failed. You've all failed
Yeah.
of not lifting people out of legislated poverty. You haven't failed by giving the billionaires their breaks. Oh no, no, they keep giving them a pat on the back. Good job, well done. Yeah,
I wanted to
What was
say,
it, 32 billion for the coal industry
yeah,
in
oh yeah,
yeah,
subsidies and direct revenue? I mean,
yeah,
come on. But we can't get more than a billion in the first year of the Canada
yeah,
Disability Benefit.
yeah.
I mean, there are other numbers with this that really bother me, like the fact that we're getting $936 million for the first year in Canada Disability Benefit for 1.8 million people in living in poverty with
right.
Yeah.
disability. But uh, what is it, 12.5 billion for the guaranteed income supplement for 2.5 million people,
Oh,
and 26 billion for 3.5 million families with children.
Yeah.
wow.
Those are the numbers that also make you say, what in the name of God were you thinking?
Yeah.
Exactly. I mean, looking at
Where
those
did this come
compared
from?
to the CDB, it's like, holy Christ, you
You
know?
focus on the CDB and how wrong it is, but when you
Yeah,
look at the ones it's supposed to be modeled on and similar to,
yeah,
and
Yeah.
they have 26 times the funding for the CCB.
Mhm.
But here's a question for you though, Cate. I thought I remember hearing that the CDB was supposed to be modeled after the GIS.
Yes, originally they said
Yeah,
the
originally.
GIS, and the GIS is 2.5 million seniors at I think it's 12 or 13 billion, the most recent budgeted amount was. But then they also snuck in and the CCB because it was supposed to bridge the ages between 18 and 64
Mhm.
that the other two policies covered. So it was supposed to be
And then
similar to
your
any of
disability
the same
goes
measure.
away. Then your disability goes away.
Yeah, poof.
Well, if you're a kid, you don't have a disability because your parents get CCB and they
Right.
pay all
There
everything.
you go.
And if you're a senior, it goes away magically because
Magically, I
you're a
just like
senior.
unicorns. Yes.
Before
But
you
yeah,
before we wrap up the show, Brent, I did want to shout out to our chat is really hopping today. I
Oh,
didn't really have a chance to really reference it much
hi
during the
everyone.
show,
Chat too.
but
oh well, hi
really
guys.
active in chat. I did want to mention one particular comment here
Hmm,
from Marion Wales.
hmm.
She says, "I was told 2 years ago by my Liberal MP, by her Liberal MP, to apply for MAID." So she had a Liberal MP tell her you should apply for MAID.
Wow. I mean, that's terrible. I'm sorry. I'm sorry.
Isn't
That
that
comment.
disgusting? I mean,
I am so sorry to hear that.
there's been
Yeah.
lots of comments in the chat, and I've been watching them, but I haven't been able to comment on all of them. But I did want to call out that one because that's disgusting.
Yeah.
So
I mean,
I completely forgot that
encouraging
people
people
might have been
to reply. Like, wow, that's terrible.
that is really gross.
That
that's
is really gross.
yeah, it's really gross.
I
Exactly.
know a situation in Alberta where a woman and her mother went into the doctor uh, to get an assessment for assisted living. You know, mom just needs help. She doesn't need like nursing home care. She just wanted assisted living. The doctor said, some people when they're getting old, they start to get forgetful and sometimes when they don't want to be a burden, they opt for medical suicide.
Mhm.
Oh my gosh.
I actually know a person that happened to. And I mean, her daughter was like, what?
Yeah,
Like,
Well,
I
yeah.
said living, and the doctor said dying.
yeah,
Hmm.
So, I mean, it's unconscionable. Don't get me going on MAID because I'll never
Yeah.
yeah.
stop.
The whole other podcast. Yeah,
Yeah. Yeah. Yeah.
Hey,
yeah.
anytime.
Yeah.
I've got all the numbers for that one too.
Yeah.
I'd love to have you on another podcast and we'll talk more on that topic,
Mhm.
right
Mhm.
with the numbers. But I guess my mic drop would be, well, before I give my ending comments is, I remember a drop-in clinic I had gone to once upon a time, Cate. I had really bad allergies and my family doctor had already retired. So I just had to go to a drop-in clinic. I didn't have a family doctor. Actually, I still don't, actually. But so anyway, I went to a drop-in clinic and the doctor didn't know me. And, and I said, well, as I guess as you age, your allergies, you either get more allergies or you get more disabilities. Well, yeah, as we get older, Brent, I mean, we get more disabilities, we get different ailments, right? Some can be cured, other ones can't be cured. But we have good days and bad days. I've had, and the gentleman told me, I have other clients who come in here and, they're really having a tough time. And, if you ever need to talk to me about medical assistance and dying, come and talk to me. I go, excuse me? Like, I mean, because like I had a problem with my knee at the time, and it was really like aching, and I had fallen off a bike, and
Mhm.
so yeah, I had a little cast on there. It didn't break anything, but I had a cast on there, and they're like, lucky you didn't break a hip or anything like that, because
Yeah.
then you'd be pain and suffering. And I'm like, where are you going with this? Like,
Next time you fall off your bike, there's
I
made
literally
for you.
walked out of the
Yeah.
guy's office. I
Yeah.
walked away. I said, yeah, I don't need to hear this.
Yeah.
Like, oh my gosh. Like,
It's
and those are
easy.
just one story. That's just one.
Mhm.
It's easier to qualify for assisted death in this country than it is to get the supports to live a dignified life.
Yeah. And
And
that's why
that
Like
I'm
to
involved
get
in
the
that
stuff.
CDB, for example.
Yeah.
yeah,
Yeah. Yeah.
Yeah. And I mean, there's so many stories that people would love to probably say what they've gone through in life, and love to hear more of your stories, everyone. And how do we change the system? How do we force the politicians to actually own up to what they committed to about the CDB, and also for provincial disability benefits? Leave your comments in the comments section. Email Neil, get you scheduled in if you want to come on the show.
Yeah, we always say that this is an open channel. Like
Yeah,
it's like an open invite for anybody that wants to come on, right?
I mean,
absolutely.
if they'll have
Yeah,
me, they'll have anyone.
that's right.
Yeah.
I mean, just consider how low our bar is, right?
Oh, but it's
Just
great.
teasing, Kate. Just teasing.
But it's awesome having you on, Cate.
Yeah,
Going
it
through these
was a good episode. Yeah.
and talking about the problems that the CDB have created. Since it was originally supposed to be launched, historic, it's going to change things. Over 1 million people down to hundreds of thousands, then down to like 25,000, and yeah, it just kind of petered all the
Kept
way down.
going down, 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 down.
Don't
And,
forget uplift. The
uplift.
legislative definition of uplift.
I think they forgot the extra zero on the end, right? I mean, yeah.
Remember the words they used? Transformative, life-changing. What were some of the other words they
Oh,
used?
but remember the
Inspirational.
yeah, but remember
Generate, yeah,
remember
yeah,
the CERB though. Remember
yeah,
when the former Prime Minister Justin Trudeau was in, $2,000 was supposed to be the most minimum that people needed.
yeah.
Well, when I heard about this CDB, when it got all watered down to up to $200, I'm like, what the hell? Like, what happened? Did it go to zero, or
CERB was passed and implemented in 11
quickly?
days.
Oh yeah, really quickly.
Mhm.
It took 1,300 days between the first time Justin Trudeau mentioned the Canada Disability Benefit without even naming it,
Oh
just
yeah.
the first time it was mentioned as a concept,
Mhm.
to the day that it ended up in Budget 24. 1,300 days versus 11.
Yeah.
One
So
thing
if you want to talk about discrimination,
Yeah, and one thing I noticed before we end the show today is the the time frame of when that announcement came. All these announcements helping this group of society, this group of
Yeah.
society, this group of society, then finally came out and said, "Well, we're going to help the most vulnerable of our population. We need to protect people. We need to uplift them," and all these magic pink unicorn words. And I thought, wow,
I always say too that the disability community is like the land of misfit toys, right? I mean, it
yeah,
really is. It's like
yeah.
we're over there on an island somewhere, you know?
Yeah, yeah.
Yeah.
It's like Santa's workshop, with all the little
Yeah.
toys. Remember,
Yeah, we're
with
we're
all,
the
with all
misfits
the little,
over in the corner. Yeah.
for all the elves
Yeah.
that came along, and they're like, boing,
Yeah.
boing, boing.
Yeah.
Yeah, yeah.
Yeah.
Anyway, I want to thank everyone for tuning in, and Cate, love to have you back on the show. We'll talk about
Really
numbers.
good show. Really good show.
Yeah, and we're going
Yeah.
forward.
well, thank you guys for having me, and guess it
Absolutely.
again.
Yeah, absolutely. And I want to thank all of our listeners for tuning in today, too. Please like, subscribe, and share the content. If you want to buy us a coffee, the like button's down there. If you
And
want
if you
to,
want to buy a mug, let us know and we'll try to get more
yeah,
mugs. Yeah.
no, these
Set
these
up a shop.
these mugs are these. I mean, and then you know what? It keeps the beverage actually quite hot in there too. Just to let you know. I mean,
Yeah.
what do you want to put hot
They're
chocolate,
also,
tea, or
I just throw something out about those mugs.
yeah,
When you have issues with your hands holding on to mugs, those are the perfect size because your
oh, they
whole
are.
hand gets in there.
Yeah,
Mhm.
and it's easy to grip onto, right? It's
Yeah.
just it's very
And they're well balanced.
yeah, they are,
Yeah.
and
Just
they're
kind of like us. We're well balanced.
yeah, yeah. That's a good mic drop right there. Thanks everyone for tuning in. Stay tuned to our next show on Friday, and we're gonna have MJ on. It's gonna be a great show.
Yeah, and
Yep.
do you
Oh,
remember?
yes.
And
And
James Schultz.
James Schultz.
Yeah.
James Schultz is going to be joining with MJ and on the next show, because they actually had given a interview on Vancouver City News about raising. I'll just give you a little sneak peek about raising the PWD shelter rate. You can't rent anywhere for $500, and BC, anywhere in Canada or anywhere in North America for 500. Imagine it was at 375 since 2007.
Mm-hmm.
Just a little bit of a history on the background of that.
Just remember, we're at the end of the podcast right now.
Yeah. The rates have been historically left where you can't rent anywhere for a whole check. But stay tuned. That's a little sneak peek for the next show. But thanks everyone for tuning in. Hope you have a great day. And thanks, Cate, for coming on.
Yeah. Thanks, everyone.
Thanks, everyone. Take care.